health workers have succumbed to pressure from the government and called off their 11-day strike. A section of members of the Health Workers Union have, however, criticized the return to work deal, terming it unprocedural.
We are aware that yesterday at night, a section of the health workers leadership entered in an agreement with the government and actually called off the strike. We are also aware that the health workers across the country have not been adequately informed about this decision of calling off the strike.
After an 11-day boycott, health workers have officially agreed to go back to work. They reached a back-to-work formula last night, albeit leaving health workers unsatisfied.
On signing this agreement, we set out with demands and goals which unfortunately we have not been able to meet.
The leaders are people who represent the electorate. They don't represent their own interests and their own aspiration. And therefore, when you don't resonate with the members on the ground, you lose as a leader. That is why today, as we are sitting here, a strike has been called off by the national officials. And yet on the ground, health workers are still going on with the strike.
The main issues that were agreed upon were that the government, through the Public Service Commission and county public service boards, will develop a comprehensive human resource policy that will address issues raised by the unions, and that salaries and benefits shall not be revised to the detriment of health workers. The government also agreed to include the workers' union in the development of the policies. The government further agreed to withdraw all pending cases against health workers, as well as penalties against those who participated in the strike. Union officials were keen to ensure that no worker is victimized.
We wonder and we don't understand what was the rush to go and make a decision within 2 hours. You have an agreement, you have forced people, they have signed already, and yet you are not resonating with your own National Executive Council. You are not resonating with your own National Governing Council. You are not resonating with the people on the ground, and you leave people at apathy. They feel dejected. They are still out there. They are now not protected. They are vulnerable to intimidation and victimization, and yet you are calling yourself a national leader.
Even as they return to work, the nurses' union will go to court to stop the devolution of referral hospitals, giving the power to county governments and not the national government.
And on Monday we shall be in court, and we are seeking to be enjoined in a petition number 593 of 2013 to ensure that the national healthcare referral system is anchored in law and is protected.
As the agreement was being made, Cabinet Secretary for Health James Macharia sent out a memo to all county authorities, asking them to give out names of those health workers who did not return to work as of the 20th of December 2013. Those who do not return to work will be punished accordingly by the Public Service Commission. Catherine Omwando, KTN.